Hi, I'm Jonathan Roux. I'm a PhD student from the French School of Public Health in Rennes, France, and I'm going to talk about a collaborative work with the OFCEP, the Observatoire Français de la Sclérose en Plaques, on the complementary use of administrative and clinical data to study DMT utilization in France. Over 2010 to 2015, there were 17 disease-modifying therapies available in France. 11 were MS-specific and 6 were off-label drugs. Despite this wide range of DMTs available, there are no data at a national level at disposal. To study this utilization, two kinds of data sources may be used. On the one hand, clinical series such as the OFCEP database, which have a strong quality but may suffer from recruitment bias. And on the other side, the SNDS, which is the French Health National Data System, which is an administrative database which have a strong quality, which is the exhaustiveness, but suffer from a lack of clinical data. So the aim of the study was to see the DMT utilization over the 2010 to 2015 period of DMTs in France and to compare the advantage and limits of the two databases, so clinical series with the OFCEP on one side and the SNDS, and so administrative data on the other side. The OFCEP database is completed by neurologists across 41 centers in France, and all the DMT who were available were present in the database, compared to the SNDS database, which covers 97% of the population, so almost all the French population, and in which we only find 13 DMTs. The one missing were those delivered in hospital, except natalizumab. On the whole, more than 36,000 people were identified in the OFCEP cohort as having at least one clinical follow-up in 2010 to 2015. And in the SNDS, thanks to a validated algorithm, we managed to identify more than 112,000 people, which we consider that was the whole population of persons with MS in France. When looking at DMTs, in the OFCEP database, we saw that almost two-thirds of the population had at least one DMT delivery, and if we considered only the MS-specific DMTs, it was this figure decreased to 55%. It was 10% higher than in the SNDS database, where only half the population had a DMT prescription. So these first results highlight the recruitment bias of the OFCEP database because of the recruitment in expert centers, and so of people who are followed for a clinic for DMT. And this result is coherent when we look specifically to the types of treatments, because the percentage of people with infusions or off-label drugs were twice the proportion observed in the SNDS. Over time, we saw it was the same, but we saw that the impact of the introduction of oral DMT and the decrease of injectables ones. And one advantage of the OFCEP database was the presence of the clinical trials, and so we had a longer follow-up, especially for oral treatments, whereas in the SNDS database we only have treatments where they are available in pharmacy. In conclusion, we can see that the two databases are really complementary, and it's the first one to clearly highlight the recruitment bias in the OFCEP database, but we have shown also that it has some good advantages, such as the presence of clinical follow of the clinical trials and more exact dates to take of the DMT prescription. And in the future, we can hope to link the two databases in order to have a clear population-based sample, and which can permit to do some pharmacoepidemiological studies. We can do pharmacoepidemiological studies which can answer to neurologist questions. For the future, I'm going to defend my PhD, and after I'm going to specialize in biostatistics to develop new methods which can be used after in multiple sclerosis, especially networks, in order to see the clinical and care practices in France, to see if there are some differences across regions, for example. Thank you.